Hi, everyone. My name is Maggie Hobstetter. I'm a research analyst with the David and Lucille Packard Foundation and also associate specialist at the Bixby Center at UC Berkeley. I'd like to thank the Center on Gender Equity and Health for inviting me here today and including me in this very important panel. So I'm delighted to be here to introduce the topic of girl-child marriage and adolescent sexual and reproductive health. Adolescent reproductive health is absolutely critical to the lives of young people, and it's also critical to the future of the Sustainable Development Movement, as highlighted by the high-level panel for ICPD. So we're lucky today to have 6 panels from Sub-Saharan Africa, South Asia, and the US. Where's the clicker? I wanted to just start my presentation with a very quick overview of youth demographics globally to kind of put us in place. So today, we have, there are more young people on Earth than ever before in our history. Nearly half the world's population is under the age of 25, the majority of whom live in developing countries. In most sub-Saharan African countries and South Asian countries, approximately 25 to 40% of the population is under the age of 15. In the US, we're experiencing our own sort of youth bulge, with 65 million millennials aged 18 to 29. And these millennials are the most progressive and diverse generation we've ever experienced. This large cohort globally presents a lot of opportunities and challenges for governments, NGOs to really respond to the needs of young people in terms of their educational needs, economic livelihoods, and of course their sexual and reproductive health needs as well. So more than ever before, young people are engaging with technology and in using technology to reach out to each other, to mobilize. And I feel like being in this room with all of you, sort of with tweeting, and we're on our phones and our computers, and we're live streaming, I think that we're all reminded of the role or the potential that technology holds to really mobilize young people for us to learn more about what their needs are and to better understand how we can respond to those needs going forward. So the question remains, if we want to use technology and we want to sort of put our best selves forward to respond to young people's needs and meet them where we are, where are they? Where are they right now in their sexual and reproductive health lives globally? So it's nearly impossible to talk about gender equity and adolescent reproductive health without talking about early marriage. As noted by multiple presenters over the last couple of days, child marriage is a deprivation of basic human rights, adolescent sexual reproductive health and rights, and a form of gender-based violence. Just a couple of notes on prevalence. In the last 10 years, 58 million girls under the age of 18, 1 in 3 in developing countries, have been married before the age of 18. 1 in 9 girls, or 15 million, in these countries was married by the age of 15. Girl-child marriage obviously has very serious implications for adolescent sexual and reproductive health, and increases vulnerabilities across a number of domains in the lives of women and girls. Girls younger than 15 are 5 times more likely to die as a result of pregnancy and childbirth than women in their 20s. Childbirth complications are the leading cause of death for girls aged 15 to 19 in developing countries. Early marriage is a predictor of early pregnancy and high fertility. Girls who marry early are vulnerable to gender-based violence, domestic violence, abuse, abandonment. They're more likely to be poor and remain poor. So in addition to child marriage, speakers today will also speak about adolescent sexual and reproductive health more broadly. So what do we know about adolescent sexual and reproductive health? In accessing services and information, young people experience heightened stigma. They experience heightened community resistance, heightened bias, adult gatekeepers, and this is all in addition to all of the barriers that we're also familiar with for women accessing services as well, including poor quality of care, access, availability, misconceptions, etc. So for young people, this leads to typically lower contraceptive use, higher discontinuation, higher unmet need, higher unintended pregnancies than their adult counterparts. So as a field, we're grappling with a number of issues related to delivering services with young people, and I just wanted to highlight a few of those. So the first really is a question I think that we're grappling with, which is, what is the right service delivery package to meet the needs of young people? And I think that, as many in the room are familiar with the literature on this, the question of whether youth-friendly services are really enough to overcome all of the barriers that young people are actually facing in the community is a big issue. In addition, adolescence is a very dynamic period. We tend to talk about adolescents as this, kind of monolithic group, but they're really diverse. There are married adolescents, unmarried adolescents, rural adolescents, urban adolescents, and then even within adolescence, just the age itself. We don't know a whole lot about very young adolescents, age 10 to 14, and as my colleague Lester yesterday highlighted, there is some growing energy around building the research agenda to learn more about what those young adolescents need and what they're experiencing. What is clear, though, is that interventions really need to respond to young people's reproductive health needs and their specific vulnerabilities. And this sort of mirrors what Jenny was speaking about earlier this morning in really responding to the intersection of social inequities in young people's lives. They're not just young, they're rural, they're experiencing GBV in the form of early marriage or other deprivations of rights. They're vulnerable because they're a girl, but really responding to these overlapping inequities and vulnerabilities. So at the Packard Foundation, I just wanted to highlight a few of the opportunities that we see going forward and where we're sort of putting a lot of our energy. We've prioritized young people across our whole program. We work in Sub-Saharan Africa, South Asia, and in the southern U.S. We are working to improve quality of CSE and ASRH services, including access to a full range of services, including comprehensive abortion care, contraception, and again, CSE. We work to shift social norms to delay age of marriage in communities and to strengthen youth voice and youth movements. Some promising approaches really start with listening to youth, really moving beyond tokenism to try to understand what do youth need and how can we actually collaborate to work better for them. So moving beyond tokenism by listening to youth. Some promising approaches include integration of services, improving quality by focusing on provider bias, provider attitudes, making young people care a lot about being treated with dignity and respect, and starting with providers we think is, in this service delivery setting, is a good way to think of that. Privacy, confidentiality, building evidence of what works, and integrating gender transformational, CSE, into sex ed curriculum in communities and in schools. So I'm very happy to introduce our panel today. I think we have very exciting lightning presentations coming up and hopefully conversation to follow. So first up will be Anita Raj. She is professor and director of GEH. She will be speaking on adolescent health risks of girl-child marriage and adolescent motherhood. We have Brandon Brown from UC Irvine, director of GREAT. Is it GREAT? G-H-R-E-A-T. Rape in Nigeria, the silent epidemic among adolescents living with HIV. Mara Decker. Dr. Mara Decker from the Bixby Center at UCSF will be presenting on adolescent sexual and reproductive health needs assessment in Ethiopia. Medical anthropologist Daniel Perlman from the UC Berkeley Bixby Center will present on decision-making leading to early marriage in northern Nigeria. Nora Vargas, VP of Communications and Government Relations at Planned Parenthood of the Pacific Southwest, will be presenting on teen reproductive health in the California-Mexico border region. And then Miriam Parra and Isabeth Rodriguez, both from the San Ysidro Health Center, will be presenting on improving access to reproductive health services for teens living in the border region of San Diego County. Thanks so much.